Don had mentioned that he tries to avoid taking drugs that mask the symptoms. Has anyone heard of cortisone and prednisone and those kind of shots? Sometimes people will have an injection of that. And why is it injected for pain? Why?
To relax them.
Sorry?
To relax the nerve.
No, not for relaxing. It's a good guess. Yeah. Anyone know? They're called. Okay, you've heard of NSAIDs, which are non-steroidal anti-inflammatory drugs. Non-steroidal. Cortisone is a steroid drug. Now, what did I say? That cortisol and adrenaline, when it's pumping through the system, what does it do to the digestive system? It shuts it down. Very good. How about the immune system? It shuts it down, right? So if you have an injection of cortisone, it shuts the immune system down, so it reduces the inflammation. So that's why it's given to the body, because it reduces inflammation. However, it's like giving yourself an artificial stress reaction. So individuals who are on cortisone, they'll come in and they just talk and talk and talk, and they can't sleep, because if you have too much cortisol, you can't fall asleep. You have too much sugar in your bloodstream. Cortisol starts in the morning, and there's a little, on this chart down the lower left-hand corner, I think it is. Lower right-hand corner, I have a little picture in a box, and it has this little line going there through the dashed lines. This black line is the normal levels of cortisol at 8 in the morning, noon, 4 p.m., and 12 a.m. Cortisol starts out high in the morning, gradually decreases through the day, and then it's its low point at around midnight, after you've gone to sleep. That's the normal amounts. If you have a lot of cortisol in your system, you wake up.
You can't sleep.
And then over time, as it decreases, cortisol puts sugar into the bloodstream so you have the energy for your brain to work and for the muscles to work. If you're eating during the day, then you're getting that energy from an outside source. So you take the food, you get the sugars, etc. And so the body doesn't produce cortisol because there's enough sugar in the bloodstream. However, when you're asleep, how many people eat when they're asleep?
You said eat?
Eat, yeah. No people like sleepwalk and go to the refrigerator, no.
I usually wake up, but I sometimes
You wake up?
get up
Yeah.
and microwave something.
Microwave, okay, all right. Yeah, so if you wake up and you eat something, you are not fasting. When we're in a fasting state, cortisol rises. So typically, during the day, the cortisol goes down. When we're asleep, the cortisol rises. We wake up in the morning, cortisol goes down during the day, and it goes back up at night when we're asleep. That's the natural way that the cortisol is in our bloodstream. So if you have a cortisone shot, then you're wide awake, you have all this energy, and you just go blah, 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 blah. And I don't know if you've been around anyone who's on steroid drugs, but they get huge.
Yeah.
They accumulate a lot of water in their system because it's not dispersed.
Yeah, I was wondering, rather than these chemical injections, what about a cold pack or something? Something more natural.
Yeah, cold pack may be helpful too. But sometimes cold causes too much constriction in the muscle and it's already too contracted and just makes it a little worse. It may deaden the pain, but it actually makes the muscle contract more. That's part of the problem.
I had another question too. I came across again because I was beginning to think about the condition I have. What about the B vitamins? Aren't they supposed to be useful for?
B vitamins might be useful. Sometimes the B vitamin injection is what may be helpful. Directly into the muscle, but it's too tight. That works sometimes. But B vitamins are the energy vitamins also. That can help. One of the common misconceptions about back pain is that you need to rest and avoid activity for a long time. In fact, bed rest is not necessarily recommended. If you can't get up and move, that's a whole other thing. But if you just have some more mild back pain, then actually getting up and exercising and doing some moderate activity may be the best thing for you. Proper exercise can actually help with lower back problems. That's proper exercise. Sometimes people exercise the wrong way.
Yeah.
But sometimes weak muscles contribute to the misalignment of the spine. So strengthening muscles should be part of any program to help restore normal function to the back. All muscles work in pairs. And for example, the biceps and triceps. Biceps, when it contracts, the arm, the hand comes to the shoulder, but the triceps has to lengthen. You go this way. Muscles on this side do what? Contract. And on this side? Lengthen. They have to. All movement is a pairing of muscles. One contracts, one relaxes. So sometimes one is reaching and there's a contraction muscle, but it contracts way too much. And it gets locked. And then the other muscle is trying to go back and it's going, let go, come on, come on. And then it'll go into a spasm. So sometimes it's just a combination of muscles suddenly locking up. Because one said, I'm not moving. I'm just not going to move. And the other one goes, come on, move it. It's too hard. And so that's sometimes, so people will make a movement and one set of muscles just locks up. And the pain can be excruciating from that kind of movement. So that may be partly what's going on that happened with you.
You think using a vibrator would be helpful?
Could be. A vibrator might help to massage and relax the muscles. Yeah, it's quite possible.
Or heat?
Heat could be also helpful, that's why I was mentioning that. So strengthening muscles can be a part of it.